We were discussing female hair losses and solutions to female hair losses. We were discussing like female hair losses treatments, and there are two options for female hair losses treatments. One is with the medicine and other is with the surgery. And surgery, when it becomes inevitable, we have to go for the surgery and no other option is left, then we have to do surgery with the female hair losses as well. Don't you think like we don't do surgeries with females? Because the thing is, it is not usually happening in any clinic, because only 2% females, they are coming for like hair fall treatments in any clinic, and they come like with the problems which can be solved like with medicines, and we opt for medical treatments first, and the last second and the last option is surgical treatment. When I told you in last video that we will be discussing surgical solutions for female hair losses, and the techniques are the same, FUT and FUE. When we are doing like FUT and FUE in male pattern hair losses, that is totally different. Like we have to trim the whole area in both cases, like to fix the baldness in male pattern hair losses, because they in male hair losses, trimming the whole area does not matter loads, but in female hair losses we cannot trim the hair. So it is to use the technique in female hair losses like FUE or FUT, it is totally different and very difficult one, because you have to take care of her social presentation when she will be going like after 2-3 days to the social gatherings. She must be feeling comfortable when attending the social gathering or going to office as well. So in short, we are going to discuss how we treat the female hair losses like in female pattern losses. So I will be discussing a young lady. Show you the picture. This is the baldness actually, and in female hair losses what we do is we will be covering this area with good thickness. Like if we cover this area, she will be having like a good thickness in this area. She can comb the hair back from here to cover this area as well. What we need to do is we should be putting hair in this area, in this area, and this area, the whole area, because rather than covering the whole area, we will need, if we're gonna cover this whole area from here to there, we need to put like 5,000 grafts. And taking 5,000 grafts in female hair losses, in female especially, when we are not trimming the hair from back of the head, is not possible. So in one session, so in first session what we will be doing is we will be covering this area. And what she is interested in getting done with the FUE technique, so we have adopted in this like FUE technique. So what we did is we took like 2,500 grafts, but 2,500 grafts we put in this area to cover, to give a good density in this area, so that if she is having very good hair in this area and covered like with the good density, she will be putting the hair on this area and everything will be looking like good thickness in the whole area. Like everything will be covered like if we put in this area. So this is sensible planning. If we do hair transplant in the frontal area, like frontal scalp and little bit of the mid scalp area, as I will show you two pictures now. We will be going to how we did the FUE treatment with her. Like this picture is just after the surgery. It is like just after the surgery. What we did is we put grafts in this area. You look, if my producer can show you a close-up picture, we did the hair transplant in this area as well. We did the hair transplant up to the extended up to this area, right from here up to the mid scalp. Like when we were discussing, we put the in this area as well. Like we did covered this area, the whole area. And in this picture you see we put grafts in this area, like this is whole covered. And this is the picture of back of the head from where I excised the FUE grafts. We took one by one from back of the head, and on this is just after surgery. And you see, cannot see like big scars like on this area. I used 0.8 millimeter punch, and when we comb in this area, you see it is just after the surgery. The whole picture, she is in the same clothes, she is in the same scenario. You see she is having like same clothes. It is just after the surgery. This is before surgery, this is just after the surgery, and combing there. You cannot see this extracted area in this picture. Actually, the reason behind to show you this this is that in female hair losses, we will be covering the whole area without trimming this area. And this picture, you see it is very neat and clean. You see some clots in this area, and we will wash it down on very second day. And the surgery took like 6-7 hours to complete the whole surgery. We put anesthetics in this area only, and we extracted from back of the head like 2500 grafts in the central area and put one by one in this area. The whole procedure took 6-7 hours to complete the whole procedure, including all the breaks, like we gave some lunch, we gave some drinks break and juices and everything. It is running inside the surgery. So what I want to show is this picture is just after surgery, and you see when we combed this area, like we put these hair down, she is like in comfortable position. You cannot see anything happening inside. Well, we have extracted 2500 grafts in this area. So what I wanted to show you in this picture is like when we are treating the female hair losses in surgery, we should be very careful in doing surgery with the female hair losses, because we cannot trim the area like we do in the male pattern hair losses. We trim the whole area from back of the head and frontal area to put the grafts and give some neat and clean surgery. In this case, we give her like neat and clean surgery without trimming anything, and did 2500 grafts in one session, and we will be putting some 2000 grafts later on after 2 years when she will be coming again. So the results in this are very good. If she is willing to give me post-operative pictures, I will show you later on when she is like in my office again. Thank you very much.